Hello there. Well, you guys can hear me. Hi there. Good afternoon. Give me a thumbs up if you can hear me. Very good. Thank you. Very good. I'm just going to give a few more minutes. It looks like I know I heard back from a couple of more people, so planning to join here. So I'll give it a little bit more time. Hi there. Good afternoon. I can see you. Can see that you've joined us, but thank you for joining. This is really meant to be very informal, but I will sort of get going and introduce myself here in just a few minutes. And if you guys can hear me, if you'll just put a thumbs up. And I don't know what time it is where you guys are, but it's now about 6 o'clock p.m. Eastern Standard Time. So if you'll just put in the chat where you're from and maybe what you plan to or if you've been following, if you are a PMHNP student maybe, or you're working as a PMHNP, just love to hear more about who you guys are as well. Very good. Thanks for joining. If you guys can hear me, give me a thumbs up in the chat, please. I just want to be sure. It's very hard for me to see the feedback on this. This is my first time going live, by the way, and so it's a little challenging for me. I'm not the best at this, but this is the first time on YouTube as well, so I'm not sure if you guys can hear me. All right. Well, once I get to the 5 minute mark here on the timer, what I'll do is just start by introducing myself, and those that are coming in, feel free to, give me questions down in the chat, but we'll formally get started in just a minute. This is meant to be short and sweet, not too formal, but really wanted to just pop on in real time. Some of you may be following me. I think the ones that are able to uh, place any messages in the chat are actual subscribers. So you guys should be able to message in the chat as long as you're on the live. Um, but I'll give it about 30 more seconds. I'll introduce myself and then I will open it up for questions from you guys, particularly about the PMHNP role. And I've shared a lot on the channel, but I did want to give this opportunity for anyone to chat with me in real time. Um, and a lot of you have actually sent emails and things like that, so I do appreciate it. But I'm not going to stay on here too long if I don't have many questions. But I'll go ahead and get started. I think I have maybe a couple people here. So Um, I will, and I do see your question, New World, so I'll address that here in just a minute. Just wanted to introduce myself. I'm Camelia. I'm a nurse practitioner, a psychiatric mental health nurse practitioner. I'm currently practicing in North Carolina, so I see a question about California here. Um, and I've been practicing for about 5 years. I just a little bit about my journey. I started out in nursing in 2006, graduated with a BSN, knew that I wanted to be a nurse for quite some time, and went forward with BSN, graduated in 2006. And I actually was very obedient, and I went forward with working in med surge as recommended. I came through a time in nursing where you just did not go to a specialty right away. And so I did that. I've worked in various areas at the bedside. I've done telehealth, I've done home health, ICU. I've also done med surg and tele, neuro. I've done a little bit of that. And I've also done nursing education. I'd like to share this story because I think it's important that it was important for me, but it's important for you guys to know that my turning point was actually when I was a nurse educator and I realized I went on with getting a nursing certificate, an education certificate, which was about half of the master's program as an educator, and realized that I actually missed patient care and I missed the FaceTime with patients. So I decided to um, really take some time away and think about what I really wanted to do going forward. And I was thinking about how I could incorporate education with clinical experience with working with patients. And the PMHNP role actually is a very good way to do that. It intertwines both of those things. And so this is, something that I have actually come back full circle with because in nursing school, I can remember still my rotation um, on the behavioral health unit with a particular patient that I will never forget. And this has come back full circle for me because of the ability to practice as a PMHNP in this field. I'd like to share that story because it has really caused me to reflect a lot in terms of why I'm here, giving my why in terms of why I chose this field. And it's really to make a difference. It's to really continue promoting quality of life for people. And that's really the foundation of the work that you do as a PMHNP. So I've practiced since 2017. I actually started and in an outpatient at a larger organization and was the first PMHNP there. So just had to navigate a few things with learning the new role in a world of medical doctors, but also just navigating the role of a provider and also in behavioral health or mental health. And I actually have found that I love the outpatient world. So most of my experience thus far has been in the outpatient world. I then transitioned to private practice with one of the physicians that I was working with at one of the organizations that I've worked at. And I actually just stopped private practice last year. And I can go on and possibly write a book about the multiple challenges, good, bad, and ugly. I think it pursue that. But I learned a lot. If I ever wanted to go back to private practice, I will have done it before. And a lot of the challenges I probably won't see ever again because of just being there before. But private practice was fun, a lot of flexibility there. But I have recently, in the last couple of years, moved back to outpatient only for a larger organization, and that is what I'm doing full time now, mostly remote. But I also work in the emergency room still as needed. And again, I could write a book about the difference there and some of the things I see there. But that's just my experience journey, the journey that I've been on as a PMHNP. New World, are you still here? It's hard for me to see who's still on and who's not. But you do have a question for me. So I actually want to open this time up for any questions. The first question I have is, what is the future of PMHNP in California? Um, I will say that California is, and of course, I'm not licensed in California as a PMHNP. Very good. Thank you for confirming that. I am sort of halfway in the process of becoming licensed there. The process is a little more stringent from state to state, particularly with California. There's lots of things that have to be done for you to get licensed there. So I'm in that process, and I have not been in a rush to do that because I'm working full time serving patients in North Carolina. But what I can tell you, I actually have a couple of mentees that live in California, and the role is obviously evolving there. From what I understand, based on the regulations that have been uplifted with it becoming an independent state, and they're on the journey or the pathway for that. So I do think, in terms of the demand and as well as opportunities, I think that's going to definitely expand there in California. And just globally, we're seeing that sort of open up for the PMHNPs. I think it's going to look much different, but you're going to start seeing probably a lot more PMHNPs um, practice independently, practice maybe in private practice. You're probably going to see a wave of that soon, because of the ability to meet a demand. There's a real need for serving patients in the mental health field right now. I'll keep you posted as I learn more. I'm actually getting real time information from one of the mentees that I've been sort of working with for the past couple of years. She's a PMHNP student now, but lives in California, and so um, I'd love to chat with you sort of off this if you want to, or if you'd like me to sort of share more there. But I think there's more to come. I definitely think there's going to be more opportunities, and really we'll be able to meet a need, globally there. I hope that answers something that maybe if you had anything more specific, you can definitely put it there in the chat. Um, but if you guys have any other questions, I'm definitely going to leave this time open for any other questions that you may have specifically about the PMHNP role. And if there's something that I can't answer, I don't know the answer to, I'm happy to do research on it or do what I need to find the answer, or point you in the right direction if I can. So I'll just wait for a few other questions if you guys have any. Thanks for those that have joined. It's hard to see who's on and who's not. There's a lot of popping on and off. Um, what is the role of a PMHNP, and do hospitals allow you to prescribe as well as do therapy? Net Surfer 239. Thank you for that question. Great question. I get this question a lot because one of the things that's important to know, despite the work that we're doing, a lot of patients, a lot of people in the public, and sometimes even in our field, don't quite know the scope of a PMHNP. So I think I did a video on this a while back, but the general scope of a PMHNP is to assess, evaluate, diagnose, and treat patients with mental health conditions. And that's, very important because some programs prepare you as a PMHNP to see patients across the lifespan. There are some patients that are programs that only prepare you to see adults. So it can get very specific or microscopic as to who you can serve, but the general census of the role is to assess, evaluate, diagnose, and treat mental health conditions for individuals, usually across the lifespan. It can include medication management. It also can include collaborating with other members of the team. That can be social work, that can be um, therapists, that can be psychologists, that can be primary care doctors. Ruling out other organic diseases is also a huge part of the role. But in terms of therapy, um, hospitals do allow you to prescribe and do some form of supportive therapy. I will say, though, just working in the emergency room, and knowing I have some peers that work in the acute inpatient side of the hospital. There's not a real focus on therapy, primarily because there are other members of the team that function in that role. meaning that in most hospital settings, you have a variety of personnel that are a part of the team. That includes social workers, licensed clinicians that usually are the ones that perform more of the supportive psychotherapy. It can be done, it's not that it's never done, but in terms of the actual focus, in the hospital, the real goal is to stabilize and to maintain safety for patients. And so, in many instances, for acute conditions, medication management is a bigger focus. However, therapy can be a part of that, but that usually doesn't fall under the real scope of a PMHNP in that particular setting. Okay, great questions. I hope that answered some of what you were asking. Um, thank you for that. You're still in school, new world, and you're searching for a preceptor. What's the easiest way to look for a preceptor for your upcoming clinical? Yeah, so great question. And I actually just had this conversation with someone yesterday. I don't know how new you are in your program. If you're like a first year student, it's never too soon to start looking. The first thing I want to say that it's very difficult, and this is unfortunate. This is the unfortunate part about um, the demand increasing as a PMHMP because we're all challenged with taking on students, possibly not having enough time or being able to take on multiple students for those that are already working. And so, because of the increased demand, it is hard for a lot of the programs to meet the needs of the students in terms of finding preceptors. Um, I know that it's not a standard for, a lot of the programs to also help to find clinical preceptorships. So I would say that there's a couple of things that you can do to start. Of course, networking with where you are now, whether that's the hospital setting, if you're working on a behavioral health unit. A lot of the personnel or sometimes the providers in those units actually have private practices where they're more willing to allow you to follow them in a different setting. Some programs don't allow you to do your preceptorships where you work, which is understood. That varies. I went to a program that did not allow me to do where I was employed, so that made it a little more challenging because most of my network was where I worked. So I would say if you can't do it there, if you're not working in a setting where you have good networking, you can definitely go to a website. There's a website called psychologytoday.com. And that's actually a website that I point students to, but I also point patients to, because what you'll find there is an extensive list of providers in the area that you want to do your preceptorship. Um, Many of them are private practices, but you may have a better opportunity to find someone who's willing to take you on. But also, just in the realm of being able to search for someone with various levels of experience, if you're needing therapy hours, or if you're needing to follow someone who sees children, adolescents, or older adults, it will literally allow you to sift through and specify what you're looking for on that website. LinkedIn is a good place as well. You can also set your profile up as a student. I've had a few requests that way. It also allows you to connect to other students there on LinkedIn. It allows you to connect to, based on some of your searches and things like that, it allows you to connect with possibly other providers that could be in your area. Um, that's sort of a more informal way. I know a lot of people don't like cold calling or emailing people that you don't know, which is understandable. Worst case scenario, that may be necessary. I will say that. um, Also, let's see, the other places, there are some informal groups on like Facebook, some of the social media sites that are specific to PMHMPs. You can search for those as well. And what those groups, I was a part of one at some point. I'm not really on Facebook as much as I was before, but you can actually, in those groups, you'll get questions. People will ping off of each other that are in the same programs and things like that in terms of where they found their preceptorship. It may be an alum that went to the school, and who has already gone through the program that can help you there too. Um, but those are just a few avenues that you can look. I know it's challenging, but do start early if no one's ever told you that. Because I was one of the people. I was literally a few days away from having to suspend my program because I could not find a preceptor. And so it's worth it, to start looking now if you can, and look in those areas. Your school should also have a list. In most instances, the problem is sometimes they don't update them. Those people are, not in those places anymore. And sometimes you just have multiple students looking for the same thing. Okay. Did that answer something for you? Are those places that you possibly looked already? Very good. Okay. Um, I'm open to any other questions you guys have. I don't have many people on here, so the ones that you guys have asked, very good. Thank you for that. Thanks for participating. This is the first time I've done this, so it's a little less engaging than I'd like it to be because I can't really see who's on. But you're welcome. Very good. But any other questions you guys have for me? Anything else you can think of right now? And some of you may have emailed me along the way. Okay. What's the difference between the MSN and DNP and PMH? And does one allow you to do more than the other? Very good question. This comes up a lot. Um, so, in most instances, the major difference with an MSN and a DNP, is that your MSN is typically more clinically focused. In that you'll do the 2 years, you'll do your clinical rotations as a PMHNP, and it still allows you to sit for the board. And I have never, I don't have any real interest in the DMP, for as a PMHNP, primarily because it does not really, at least in my state of North Carolina, it does not allow me to do more unless I wanted to be, an educator, at a 4 year university, or if I wanted to, be in administration for like a large hospital organization. There is some value to the DMP, because it does help to focus on, research and more of the clinical outcomes aspect of things. But in terms of the hands-on, that's where you're going to get most of that through the MSN, and then your DMP is an extension of some of that, of course, with some of the researched, based. The things that tasks that you'll perform, you do have a project as a DMP that you have to complete, but really, once you graduate, the difference here in North Carolina, at least, it does not allow me to do more unless I wanted to work in an institution, an educational institution, or if I wanted to, work in a higher level administration, such as in a hospital setting. Those are where DMPs are actually sought out for in those positions. Um, but in terms of me working and serving patients like I do every single day as a PMHNP, it does not require me to have a DNP. And honestly, I have not pursued that because of that. The return on investment for me in terms of where I am in my career, honestly, it's just not there right now. So it's not for everybody. It is for a lot of people though, and I know many that have actually gone forward. I'm never going to say never in terms of, pursuing that, but right now it won't allow me to do much more than I want to do in my career right now in terms of serving patients. Okay. I hope that answers your question some. And I also encourage you, to look in your state and see, what positions are out there for DMP, those that have their degrees as a DMP, primarily because it is different in different states. And some states recognize it more than others. It's just that I'm in a state where it's not recognized as much in terms of, me serving patients every day. I'm not even paid on a higher scale from where I am now, based on just because if I were to have a DNP. So it doesn't allow me to do much more in what I'm doing right now. Okay. Okay. Very good. Very good. Thank you for the feedback. Um, Other questions you guys have? I think I may have a couple of new people on here, and I'm not going to exhaust your time, but I'm going to give it like a few more minutes, about 5 more minutes until about 6:30, to see if you guys have any other questions for me right now. And this is open for anyone who has questions about the PMHNP role or anything that you need possibly clarified, you want me to verify based on my experience. I try not to share anything that I have not experienced because I don't think it does you any good. Okay. But I can point you in the right direction if you have other questions. Anything else you guys have for me this evening? Where are you guys from? If you don't mind putting that in the chat for me. Anybody from North Carolina? Not seeing anybody there. Okay. California. Okay. Hence the question you had from about California. Very good. Um, yeah, so I see that you have another question. What are your thoughts on direct entry MSN DMP programs for non-BSN applicants? You're from New York and you just got accepted to a program in MA, Massachusetts. Okay. Um, so I don't think that there's much difference in terms of the outcomes that you'll get from the program. Um, I will say, honestly, are you an ADN nurse? What's your focus? Where will you be starting as in the nursing world? Are you possibly practicing? Do you have an ADN or an associate's degree in nursing? Okay, not sure if you have an ADN or not. However, you know, honestly, for non-BSN applicants, you have a non-nursing background and a bachelor's in psych. Psych. Okay. Yeah. So I will say that if you have a non-nursing background, um, it can be a little more challenging. However, I can't speak for someone who hasn't been through the nursing route. In that your outcomes may still be the same, but a lot of the things that you actually um, go through in terms of becoming a nurse, I found that those skills were important for me as a PMHNP. So the foundation for most NP programs is to have been a nurse first. And I think the reason for that is based in many different things, but I also think that some of the skills that you learn in nursing are a good foundation for becoming a PMHNP. Um, it doesn't mean that you can acquire those skills though. So I think it really comes to you as an individual in terms of what you want to gain from this. If you want to practice, in this field, you have a bachelor's in psych already. So you have some of the basic knowledge, it sounds like, for what you will be doing in terms of, how you'll be managing this population. However, I think some of the skills that are acquired as you go through the nursing route can be helpful for you down the road. But again, it doesn't mean that it can't be acquired. Obviously, it's been done. So I would say that it's probably good for you to maybe connect with someone who's been through the program if you have not started it, just to see what their outcomes have been, what they've gained from it, and what they feel like they're set up for in terms of practicing, or doing whatever you do when you're finished with the program. So I can't really speak a lot on that, other than I think that some of the skills in nursing are important and that they are helpful. However, again, those skills can still be acquired if you don't have a nursing background. But I would say to get more real time data, maybe see if you can connect with any of the post grad or the students that have already graduated from the program, to see what their experience has been like. Okay. And I know that was a little bit more indirect because I can't really speak from that side of things. Yeah. I know those programs exist though, so and I do think that they're growing. So it obviously can be done, and it doesn't mean that you won't be successful or be able to get, where you need to be in terms of this journey. But because you have a lot of the foundation, of course, in with what your bachelor's degree is in. Yeah. Okay. All right. Very good. Yeah. Other questions, guys. It's 6:30. I do plan to get back on at some point, and I may have some of you join me if you are interested on the Facebook, so I can actually see you. I didn't realize that I couldn't see you guys as well, and I can't also see who's on and off. I just see the number sort of fluctuating here, so it would be good to actually see who you guys are at some point. But what other questions do you have before I end the live today? Any other questions? Anything that you guys can think of? Any other questions? Last minute questions? Anything about the PMHNP role? Okay. All right. Well, I do appreciate you guys being on with me this evening for me. Um, Feel free to use any of the ways to communicate with me if you want. If you have more specific questions, sometimes people don't like putting questions, individual questions on. Okay, you have one more question. No problem. If the program does not give you a BSN, only the ability to take the NCLEX and receive your RN, and then complete the DNP program, does that put you at a disadvantage? Um, it should not put you at a disadvantage, as long as you are successful with the avenue that you take in terms of passing the NCLEX. Because really that's what matters in terms of your licensure and certification, is that you have to have that RN first, not necessarily a BSN. So nothing says that you have to have directly a BSN to transfer, to become an MSN or to have an MSN before you are able to take the boards. There's different ways to get there. There are some nurses who go directly from an ADN, which is why I was asking that question. So it does not mean that you have to have a BSN, and I don't think it would put you at any disadvantage, because as long as you pass the NCLEX, you are able to show that you're certified as an RN at that point based on the state, and then your licensure, as a PMHNP, once you complete the DMP program, your licensure will allow you to practice as a PMHNP. But the foundation of that licensure is to actually have, or the certification is to have the RN licensure. So no one really goes in and checks to see if you had a BSN first. As long as you have the RN, you're able to verify that with the Board of Nursing. And then from there, the Board of Nursing is what actually authorizes you to sit for an exam as a PMHNP. So I don't think that's going to put you at any disadvantage. There are multiple practicing um, clinicians that have not gone the BSN route. Yeah, very good question. Yeah. And again, I think the only disadvantage that could come about is just based on some of the skills. Yeah, you're welcome. Some of the skills that you acquire, when you go through the BSN program. But as long as you are able to validate that you've passed, you're an RN. From there, the RN licensure allows you to become certified and take the board. So I don't think that, in terms of finding a job or being able to practice, no, you won't have any disadvantage there. Okay. Yeah, you're welcome. Very good. All right. Any other questions? I really appreciate you guys popping on here today for the 30 minutes or so. I do plan to do another one of these at some point. And like I said, I'd like to see you guys. That was my plan. So I do want to formally have that and a way to do that at some point. But feel free to message me on any of the platforms. All of that is in the description or the description section of the channel. If you have more specific questions for me, what I was saying is that a lot of people don't like to ask their personal questions on like a public platform, which is understood. So you can definitely message me, email me. I've gotten quite a few over the last couple of weeks. This is the time where people are either graduating or getting ready to start a program or applying for programs. So I'm open to any questions. Like I said, if I can answer them for you, I'll let you know. If not, I'll point you in the right direction. But if you guys don't have anything else, I hope that you have a good evening. If it's evening where you are, maybe morning or afternoon. And I look forward to still connecting with you guys here on this channel in the near future. Okay. You guys have a good evening. Thank you. Bye bye.